Hi to everyone who's joining. Just very quickly, we're going to have the minute silence starting from now to remember those who've lost their lives from coronavirus on the front line. Okay, that marks the end of the minute silence. Welcome everybody. My name is Camilla Tominey. I'm the Associate Editor of The Telegraph, and I'm going to be hosting this Malaria No More webinar this morning. We have with us an esteemed panel of guests who I'll very briefly introduce, and then we'll introduce them fully for them to speak in a moment once we've just gone through some of the technical details. So we have with us Wendy Morton MP, who should be joining soon, Parliamentary Under Secretary for State for Foreign and Commonwealth Office and Development for International Development. We have Pedro Alonso, a doctor at the Director of the Global Malaria Programme at the WHO. If you could make yourself known, Dr. Alonso, that would be great. We have Professor Azra Ghani, who is the Chair in Infectious Disease Epidemiology at Imperial. If you can make yourself known, that would be brilliant. Thank you. We have Dr. Thomas Churcher, who's Senior Lecturer at the Faculty of Medicine, the School of Public Health at Imperial. And we also have, welcome, thank you. And we also have Dr. Elvis Eze. Is it Eze, Elvis? Yes. Medical doctor specialising in emergency medicine and disaster management across the Commonwealth and the Youth Ambassador for Malaria No More UK. So obviously we have our panellists here and I'm going to be chairing. Unfortunately, Yasmin Qureshi MP is not able to join us this morning. She's dealing with an urgent case. We've got lots of people who are tuning in, both from the political, the health and other sectors, interested really in how we can talk about taking the case for curing malaria forward, not least in light of a global pandemic that is quite obviously and necessarily taking up a huge amount of thinking and talking space right now in the global health sector. From a technological point of view, we've already got pre-arranged questions that we're going to put to the panellists that you can listen in on, and equally the panellists are each going to speak for 3 minutes and I'm going to introduce them momentarily. We can't, in ordinary times, of course, we would want this to be a very interactive forum, and if it was in a room at Parliament or elsewhere, we'd have people putting up their hands and engaging. Unfortunately, we can't do that with what's been going on, but we will try and be as comprehensive as possible, and the panellists will attempt to answer all angles of this so that you can get a better understanding of this issue right now as it stands. There is an opportunity to use the web chat facility within the webinar where we can perhaps address issues that you don't think are being addressed, but the panelists will do their best to make sure that most of the questions are not going unanswered this morning. So let's just give a bit of a background really to this issue. When we're talking about coronavirus and COVID-19, obviously that does take up a huge amount of the dialogue when talking about global health. And we know that the world have got plenty of experience in fighting disease. We've seen that in the malaria space, and we've also been interested to see the different reactions to this particular pandemic, and we've made comparisons between European states, Western states versus other states that seem to have coped a lot better, had much more preparedness, such as South Korea, which keeps on being cited as a beacon for the trace, track and test system. But equally, we have seen and we have observed when it comes to trying to work out malaria, when dealing with an even more pernicious pandemic in Ebola, what can be achieved by the world and the international community coming together and being united in a global response. And some of the political criticism that has happened in the last 5 weeks, I think, has been this sense that there hasn't been the joined up thinking that there could have been early on in trying to fight this particular pandemic, concerns about cooperation between different countries. As far as the UK is concerned, in the UK's contribution to the fight against malaria, we are one of the leading lights. So our current commitment is to spend 500 million per year until March 2021. We've been at the forefront of global efforts, and we have saved over 7 million lives and prevented, we estimate, more than 1 billion cases since 2000. So that's obviously a huge commitment to the fight against malaria, but also a huge success rate when it comes to what has been done over the last 2 decades. Unfortunately, though, what we've witnessed in recent years is the progress beginning to stall, and actually we're hearing, and we will hear from expert today, talking about how the current pandemic actually risks reversing some of the hard-won gains in the malaria space. We don't want to see the health and well-being of any communities compromised, but obviously if we're going to see COVID hit communities that are also dealing with malaria, then malaria may momentarily take second preference, and that's not anything that anybody who's working towards finding cures for malaria wants to see. The global theme and the timing of this is to coincide with World Malaria Day, which is on Sunday. Zero malaria starts with me, and that emphasises the power and responsibility, no matter where we live, to ensure that no one dies from a mosquito bite. And we need everybody to be accountable in the fight against malaria, even when there are other global pandemics that happen to be taking all of the headlines right now. So to conclude, it's only by working together that we can solve this. We can look at the COVID-19 experience and relate it to the work that's being done in malaria. And we can also be very pleased this morning, and it shows the interest in this particular subject, not only that we've got the esteemed panelists that we have, but also we've got all of the people tuning into this webinar this morning. So thanks for joining us, and let's now try and have a discussion about exactly where we take this in order to make sure that malaria doesn't fall backwards and continues to make the progress globally that it has over the last 2 decades. So as I said, we're going to have each of the panelists making remarks for 3 minutes each. Wendy's unfortunately having technical problems. I don't think Wendy is with us yet. So I think what we're going to do is we're going to skip to Dr. Pedro Alonso. Again, to remind you, he's the director for the Global Malarial Programme at the WHO. WHO's had its work cut out, but Dr. Alonso is still doing fabulous work in malaria. And let's hand to him now, and hopefully we can come back to Wendy next.
Well, good morning, Camilla, and good morning to all the other colleagues in the panel and those listening. In my opening statements, I'll start by somehow stating the obvious. We are living through really an unprecedented challenge from the global health perspective, not even yet talking about malaria. And we're seeing it we started seeing it in Asia, we're seeing it in Europe and in the US. And we see the initial stages of what could be the epidemic in some of the malaria endemic areas, particularly thinking of Africa. The second thing is that we are challenged in terms of how do we manage uncertainty. One of the features of this epidemic is that, of course, it's a new virus. Its behavior is not yet fully understood. Key parameters about its transmissibility, its case fatality rate, its interaction with comorbidities are pretty much unknown, and particularly, again, when thinking of an African environment. And thus, the management of uncertainty, first of all, with regards to the biology and its medical effects. Secondly, the impact it will have on the economies and other elements that may provoke social disruptions becomes a key element that we have to keep in mind. The third one is, and this relates to some of your opening statements, Camilla, is that we've inherited a decade of amazing progress. 7 million deaths averted over the first 15 years or so of this century. Declines in disease and transmission, and although indeed we had seen over the last 3-4 years some plateauing in our progress, we had also put in place measures to try to further accelerate in our gains, and this is what we've often referred to as the high burden, high impact response? How can we be smarter in the use of our tools and the resources available to get back on track to meet our global technical strategies, the World Health Assembly's approved global goals in the fight against malaria for 2025 and 2030. So it is that is my fourth opening statement. Our challenge, and that's I presume what we're going to be discussing about today, is how can we preserve the gains achieved over the last 15 years in our fight against malaria in the context of the COVID epidemic, accepting all the uncertainties that we have, and how can we do so in avoiding a false dichotomy of we're trying to preserve our gains against malaria at the expense of allowing COVID to expand, or vice versa. Where we are going to be tested is how can we do both things at the same time. Preserve the gains in the fight against malaria while trying to mitigate or prevent as much as possible the transmission of COVID in the malaria endemic areas.
Thank you very much, Dr. Alonso. We're just seeing whether we can get Wendy Morton MP now. I think there's still some internet connection problems, and the same for Professor Ghani. I'm just waiting on the web chat here just to see if that can be resolved. I think we're going to move to, should we move to Thomas, Dr. Thomas Churcher, just while you are here, Thomas, and you're not having connection problems, Senior Lecturer at the Faculty of Medicine, the School of Public Health at Imperial College London. I think, Dr. Thomas, if you take it away now, and we'll come back to our other panellists once they've resolved their technical issues. Thank you.
Sure. Well, thank you for the introduction. Really echo the comments by Dr. Alonso. This is a kind of key moment for both diseases. You know, both diseases by themselves are terrible. Both together at the same time in the same vulnerable communities could be catastrophic. And the difference between COVID and malaria is that with COVID, things are very much unknown. With malaria, we have the tools we need to be able to control this disease. We've been doing very well for the last 20 years, really pushing down morbidity and mortality associated with these diseases. And so that really needs to be maintained as much as possible through the flux that COVID will cause. So the big advantages have really been through the distribution and widespread use of insecticide-treated bed nets, which have really prevented malaria from happening. And these preventative measures, along with treatment, really need to be maintained throughout any kind of COVID epidemic that could spread. Because if you can kind of prevent a case of malaria, you can prevent somebody having malaria at a time when the health system might be under really great flux. People may be unable to access treatments. They may be unwilling to go to community health systems, even if they're available to be used. And so these preventative measures really need to be in place as early as possible, ideally before any COVID epidemic hits, to really kind of help the health system, help prevent malaria, and effectively use these tools that we know how to use, how to deploy, to make sure that they're in communities at the time they're at their greatest need. And if we can do that, then we can really have a huge impact on both COVID and malaria itself in these locations.
Okay, thank you very much, Dr. Churcher. I think we now have Professor Ghani back. Hopefully your internet connection isn't going to let you down. If you can unmute yourself, Professor Ghani, just to remind the audience, you're the Chair in Infectious Disease Epidemiology at Imperial College London. Imperial again, very much in the headlines with regard to COVID-19, but let's hear from the Professor now about malaria. Thank you.
Hi, yes, good morning to everyone. So I was just going to make actually a few remarks more in the context of the coronavirus pandemic. It's an area we've been clearly working on quite intensely over the last few months, and we've had a particular focus on trying to support low and middle income countries. And I think what's concerning is that we are starting to see epidemics taking off in many of the malaria endemic countries. In Asia, India and Indonesia in particular are affected. In Africa, we're starting to see quite large epidemics occurring in Cameroon, Burkina Faso and Nigeria. All of these are very high endemic malaria areas. And clearly there's going to be quite a lot of local attention focused towards the COVID response, which is inevitably going to take away some of the workforce that would normally be providing malaria services. So it's clearly going to have an impact. We can't avoid that. There's going to be a direct impact on health services. We've already heard in several countries that we're working with on the COVID response that hospitals are nearly full with COVID patients. We've seen that in Europe. It's starting to happen in Africa. And it's also likely to affect the primary healthcare services where first-line treatment of malaria is sought. We're particularly concerned about the overlap with symptoms. Fever is one of the primary symptoms for coronavirus. It's clearly a very clear indicator of malaria as well. So it's very important that the diagnostic tests for malaria are available to be able to distinguish these. I think we also need to think a little bit more broadly about the direct impact of the social distancing and movement restrictions that are being put in place. This will clearly impact, as has already been said, the delivery of things like nets, key services such as chemoprevention and prevention of malaria in pregnancy, and also is likely to start affecting the supply chains. And that's something that we need to be planning for early to try and ensure that the key commodities get into countries as planned. And then just finally, I wanted to say, I think it's going to have some longer term, broader impacts. In the near term, there's a wide impact on the microeconomies of these countries in terms of labour force, workforces off sick, and delivery of services. But after the pandemic is hopefully contained and over, there will be an impact on the economics of these countries, and particularly the lower income settings are going to feel the widest macroeconomic impact of the global pandemic. This is going to have consequences, particularly for the plans that we had for increased domestic resourcing of malaria. And so this is very much something that the donor community needs to keep its eye on and try to fill that gap as far as is possible.
Okay, thanks very much, Prof. Now we had Wendy Morton. She's now gone again. Let's just see if she can come back quickly. I'm told that Wendy's almost in. She's just getting her audio set up. I just saw her face flash up, but now she's disappeared. I might go to Dr. Elvis actually, just while Wendy gets herself fully settled. Dr. Elvis Eze, as I said earlier, is a medical doctor specialising in emergency medicine and disaster management across the Commonwealth. And Dr. Elvis is also a youth ambassador for Malaria No More. Doctor, tell us about what you can tell us this morning about what you're thinking with regard to coronavirus and malaria and the fight ahead.
It's really great to join this webinar, and I would really be echoing some of the points that have already been made by Professor Ghani, by Dr. Thomas and Dr. Alonso. Really, for me, it's been about focusing on the human cost of both coronavirus and malaria. I was just going to say that 48 hours ago, I had a call from my older sister who is currently in Nigeria. She lives in Lagos, she works there, and she has a young child, it's a girl child, my niece, who had fever. And for 48 hours, she kept thinking, oh, I don't really want to go to the hospital. This is really a big problem, but I can't do that because of COVID. So she has had to delay, and this is just an example of what is happening around the world, but most importantly for me, in countries with resource shortages like Nigeria. She's had to be much more careful and much more cautious about going into hospital to get her child checked. And so we have a lot of these stories happening, and it might just be that it is malaria that has happened to her young child, but however, it's just caused her more worries. So just taking that as an example of what is happening for everyone, where people are much more scared to seek healthcare. In the UK, I've worked in the UK in the NHS Southend Hospital as an emergency doctor, and I know that patients are able currently to get in touch with doctors through telemedicine, and in some ways that has kind of helped. But for countries like Nigeria and a lot of the sub-Saharan countries who are endemic for malaria, you would see we don't really have that type of resources to get people evaluated from using telemedicine. However, when you think through that, what that means for the health systems, it means that those health systems would be much more burdened by a combination of COVID and malaria. So taking it down to what my colleagues are then having to face is that there is a bigger burden. I know the world is currently battling with the pandemic, but there is, and we expect that there will be a bigger burden to countries that have resource shortages in general. And for frontline workers, I really have to mention that we need to look into what we talk about, which is about the PPE shortages, because a lot more people need to be protected. A lot of the frontline workers, emergency medicine doctors, the cleaners, and everyone out there. From my colleagues, both in Nigeria and the UK, and a few in the US, I do know that PPE shortages, in conjunction with the rest of the shortages we know about testing kits, is a problem. So a focus on having that systems approach where we're looking at some of what we're having shortages in, but also thinking about the human cost of both diseases would really work out well for us. And then finally, we know that for malaria, we need to look at making sure we protect services like distribution of insecticide-treated nets, which would help at this point reduce the burden on the health systems from diseases like malaria. Thank you.
Thank you very much, Dr. Elvis. And now we can be joined by Wendy Morton, who is the MP for Aldbridge and Brownhills in the West Midlands. She's been the Tory MP there since 2015, and she's now Parliamentary Under Secretary of State for European Neighbourhoods and the Americas. So Wendy, thank you very much for joining us, and you have 3 minutes to speak. Thank you.
Thank you, Camilla. Thank you for your patience this morning with the technology front, and thanks for the introduction, and to Malaria No More UK for inviting me to speak on the webinar today. And it's wonderful that so many people have joined the session, and I hope everyone's keeping safe and well in these challenging times. This year, as World Malaria Day takes place during the global COVID-19 pandemic, I want to focus on the impact that this is having on other killer diseases and health conditions such as malaria. Overall, we have seen remarkable progress on malaria in the last 2 decades, but the COVID-19 pandemic is threatening these hard-won gains. As the pandemic takes hold, countries are struggling to provide essential health services to prevent and control malaria, and this puts thousands of people at increased risk of illness and death. And as always, it's the most vulnerable people who will suffer the worst. Our priority for malaria during the COVID-19 pandemic must be protecting progress, ensuring essential services continue, and helping countries build strong, resilient health systems that meet the needs of all people. We know what we need to do. The UK is a long-standing leader in global health and malaria. We have bold manifesto commitments that demonstrate our ambition on malaria and on ending the preventable deaths of mothers, newborns and children. Our range of malaria investments is broad and it's strategic. Most recently, we committed up to £1.4 billion in the Global Fund to fight AIDS, malaria and tuberculosis for the next 3 years. This included a £200 million malaria match fund to stimulate private sector investment, which has already met its target. COVID-19 challenges us to do more. DFID is working around the clock to support countries to provide essential services for malaria and other health priorities. But it's clear we cannot tackle deadly diseases or fight pandemics without investing in strong health systems. Every person in every country needs fair access to essential quality health and nutrition services, provided through strong health systems without experiencing financial hardship. And that's why the UK is a proud champion of universal health coverage. Universal health coverage is the best way to ensure all people can access life-saving care for malaria and other health needs, and benefit from public health measures such as water, hygiene and sanitation services that prevent the spread of COVID-19 and other diseases. And so I thank you for the opportunity to celebrate World Malaria Day with such a distinguished panel. And I look forward to listening to some of the comments and the questions that I know are coming next. Thank you.
Thanks very much, Wendy. So yeah, we will have some questions now. Everyone has spoken. Obviously, there's quite a few interesting themes that have been brought up. I hadn't considered the point that Dr. Eze just made about PPE and the availability of it in developing countries that are fighting malaria and other diseases, as well as COVID-19. We've had our problems in this country, but of course we can see that magnified in areas where PPE is in short supply anyway. Equally, this idea about supply chains, and particularly the insecticide treated nets, which are absolutely crucial in the fight against malaria, and their lack of availability could have an enormous impact. It's a simple thing, isn't it, to think about just nets being such a crucial barrier to people getting this pernicious illness, and yet if those supply chains are slowed down or stopped, then of course people will die. And equally, I think just looking at the idea of trying to see the developing world still prioritise malaria in the face of a very serious and perhaps seemingly more immediate threat, and the difficulty that I think Professor Ghani just pointed out in the mixture of symptoms and people who might have coronavirus mistaking it for other diseases, and people who might have malaria mistaking it for COVID-19 is complicated. There's a few pre-prepared questions that I'm going to ask of the panellists now, and then we've got some questions that have been submitted by some of the MPs watching. Again, apologies that I'm the one asking these questions. I didn't come up with them, cleverer people than I did, but I'll be putting them because it's easier than having to field lots of questions coming in on a Zoom conference call, which is never easy at the best of times. So the first question is going to be directed at Wendy Morton, the MP. In the long term, Wendy, how can you see the UK continuing its global leadership on malaria as the central pillar of strengthening health systems in order to protect lives both now and in the future?
I think this is a really good question, Camilla. And the UK has a bold manifesto commitment on malaria, and this goes hand in hand with our manifesto commitment on ending preventable deaths. We want to be ambitious, and we want to galvanise action on malaria, and we're committed to the vision of a malaria-free world. You're absolutely right that the UK must place malaria within our approach to strengthening health systems. High quality, affordable and accessible malaria prevention and treatment must be integrated into primary and community-based services to reach everyone who needs them. This will not happen unless countries invest in strong health systems and commit to universal health coverage. UK leadership reflects the needs of people affected by malaria, but who are they? As we know, they're primarily the poor and vulnerable who are living in poor and vulnerable settings. Pregnant women, young children are among those who are disproportionately affected, as are those marginalised by society. And for these people, addressing malaria is only part of the story. They need access to essential quality services provided through strong health systems to meet their needs over the course of their lives without facing financial hardship. And today, COVID-19 threatens to overwhelm these health systems and put progress on malaria at risk. The pandemic will have short and long-term effects for malaria. Last week, the World Health Organization released a very sobering report outlining what could happen for malaria if prevention and control reduces this year. Its worst case scenario is shocking, estimating that malaria deaths in sub-Saharan Africa in 2020 could reach over 750,000. Now that's twice the number of deaths reported in the region in 2018 and more than we saw in the year 2000. And that's why the UK's priority today is to support countries to continue providing essential health services for malaria during this pandemic. We're actively flexing our health programmes to make this happen. We're working closely with global health initiatives and key multilaterals to ensure they respond in a way that protects malaria. We're drawing on our global networks and providing expert advice to help countries make good decisions for malaria. We're grateful for the World Health Organized leadership at this time, and I'd like to personally thank Dr. Alonso here for the work that his team have been doing in such difficult circumstances. But over the long term, it's clear that the road ahead for malaria is hard, and UK leadership will be needed more than ever. Our focus on health systems strengthening for malaria will remain front and centre. We will invest in helping countries build back better following the COVID-19 pandemic, so that future pandemics do not jeopardise progress on malaria. We will seek to integrate malaria prevention and treatment into national health systems as closely as possible, championing joined-up service delivery, especially for women and children, and streamlining surveillance, community outreach and supplies distribution. We'll continue our pioneering work on research and development for malaria, and we desperately need new tools to tackle this disease, especially as the older ones are becoming less effective. But new tools themselves are not enough. We will work with partners around the world to find innovative solutions to get these tools scaled up, made accessible and affordable for the communities that need them, including through support to unit aid. We will continue to invest heavily in core funds of the malaria response. We're investing 1.4 billion in the Global Fund to fight AIDS, TB and malaria between 2020 and 2022. And this investment will help distribute 92 million mosquito nets to protect children and families from malaria, as well as treating those who fall sick and finding new tools to combat drug and insecticide resistance. Crucially, though, it will help make countries' health systems stronger, supporting progress towards all the health goals. In all of this, the UK will remember that the people most at risk of malaria have complex needs. They're often, as I've said, the poorest and the most vulnerable people who are faced with other threats and challenges. They can face food shortages, poor sanitation, inadequate access to clean water, barriers to education, and insecure jobs. They are the most likely to be hit by COVID-19. And that's why the UK will continue to work with others, both within the malaria community and across other sectors, to meet the needs of the poorest and most vulnerable people. We've been so impressed by the way the global malaria community has pulled together during this pandemic, and the UK is proud to be part of this community and to play our part. Thanks.
Thanks, Wendy. Dr. Alonso, obviously as Director of the Global Malarial Programme at the WHO, you'll be familiar with that report that Wendy cited. Very sobering, as she said, a worst case scenario that we could see 750,000 deaths in sub-Saharan Africa. Obviously, governments are going to have to prioritise their own World Health concerns and contributions. What do you think donor governments should be prioritising, particularly in terms of their response to COVID-19, in order to protect that hard-won progress on malaria?
Let me unmute. Thank you very much. Perhaps before actually answering your question, let me applaud and recognize the words of MP Wendy Morton, which really resonate and give us hope and strength and inspiration from all we've heard. And this is not just what she's just said now, but the long-term leadership of the UK in the fight against malaria and broadly in global health. So a deep appreciation for your words and the leadership that the UK is exhibiting at this time and in previous times. Let me also just say a couple of words. You've alluded to the report that was launched a few days ago, that looks at different scenarios of what the impact of different service disruptions, be this in the access to diagnosis or treatment or distribution of vector control tools, could actually have in terms of malaria disease and death. In other words, something that Professor Azra Ghani was alluding to, some of the indirect consequences of COVID-19, not looking specifically at what COVID-19 would do in terms of disease and death, but rather the disruptions that caused by that could actually imply in terms of malaria. A disclaimer, as I said at the very beginning of my first question, we live with uncertainty. We don't know yet how is it going to behave. My colleagues have alluded to initial data from Cameroon or from Burkina Faso, but other areas seem to be less affected. Is that simply that the virus has not hit yet there, or is it simply that most of the countries have only one lab that can actually diagnose COVID infection? So we are operating in a space where we really lack data and we really lack information to help guide our response. From the WHO side, what we've done, and again, I thank Wendy Morton for her words, we've really brought the malaria community together, all partners, and certainly DFID at the table in terms of trying to understand and align our work. Disruption of the supply chain is a major one, be this on the medicines, on the vector control tools, on the diagnostics. And every week we have a risks register, and every week we have different red flags coming up. Closure of borders in India represents a challenge, as a significant proportion of our antimalarials get produced there. Potential risk of some of the very few companies that produce diagnostic tests shifting their production to COVID tests and moving away from malaria tests could provoke a massive shortage of RDTs in the coming weeks. So that's one area, the research and development space, trying to again bring all the key partners together, because we don't understand how COVID is going to operate in a malaria environment. Is malaria going to be a cofactor that leads to increased risk of severity and death due to COVID? Is it going to further promote transmission? What's COVID-19 going to behave in the face of anemia, or of pneumonias, or of tuberculosis, or of immunosuppression due to HIV? These are major unknowns, and only by coming together will we hopefully start shedding light around this. We've also jointly developed a specific guidance in terms of what can we do to control malaria in a COVID-safe environment, and what are the response elements that the community and the countries, most importantly, can put in place. And what would emergency measures look like? Will we have to revert to presumptive treatment of malaria? Or will we be forced to revert to presumptive treatment if there are no diagnostic tests available? Will we have to enact emergency mass drug administration campaigns, as we had to do during the Ebola times? So these are all major questions that we're trying to address as a global community, and we really, again, welcome and appreciate the leadership of the UK. Coming back to your question, I think a few key elements. And that's something we've learned over the years and in pre-COVID times. Context matters. And thus, tailoring our interventions and our response to the different phases where countries may find themselves in a COVID epidemic is really important, just as it is important for routine malaria control. We've seen it in Europe, we've seen it in China. COVID is different everywhere. Within a given country, within a given city, it doesn't behave in the same way. And thus, having data to help us drive what is the optimal response to a given situation in a given point in time is going to be really important. The second, I think, key element, which again is a lesson that we've learned over the past years, our role as in our case, WHO, and I believe broadly of the malaria community, and I know that that's very close to the heart of the action of the UK, is we all try to help countries solve problems, not apply universal recipes, one size fits all, but empower them to be effective in applying the best tools, the best approaches in a given circumstance, in a given point in time.
Thanks, Dr. Alonso. Our Imperial experts, Dr. Churcher and Professor Ghani, I am going to bring you in a second, but in the immediate term, I'm just going to ask a question of Dr. Eze, because you're on the ground there, you work as a doctor in Commonwealth countries, and you're also a youth ambassador for Malaria No More. Can you just give us an insight into what challenges you're facing on a daily basis, and what can the global community do to support doctors and frontline workers like yourself?
Thank you so much, Camilla. I think the biggest challenge for frontline workers and doctors is really PPE shortages, testing, because as we've seen both in the UK and even in Nigeria, when COVID arrived, the biggest challenge has been testing, and even essential workers, essential health workers have not been able to access testing. And this is more something I can speak to in Nigeria than any other place, where even when you have symptoms, you're not able to test. So a lot of what we do need is supplies. And we know that everyone around the world is having some challenges with supplies. And this is the reason why people in resource limited settings are unable to really get a lot of the support from the global community. However, we also know that there are stories of innovation that have been coming out in these countries. Like we know Senegal has done a lot of work in trying to contextualize how they provide kits and PPEs for their frontline workers. And global communities supporting that in some way might be much more efficient to support the people on the front lines. But in general, PPEs for frontline workers is our biggest challenge. And I would extend this to the malaria fight, meaning if we're able to provide PPEs for community health workers, they can go into communities and still continue those essential services like distributing insecticide-treated nets and also doing seasonal chemo prevention as we approach the peak of the rainy season in countries in West Africa. Thank you.
Thanks, Dr. Eze. Just a very quick follow-up question there, and I appreciate the generalised nature of it, but as PPE in this country has taken up so many headlines rightly because of this sense that we haven't been well prepared, is there a sense in Commonwealth countries that a lot of different global communities are dealing with exactly the same issue? And this idea that there are lots of countries like Britain who haven't got the PPE out fast enough to frontline staff?
Yeah, there is a sense of that it's a global challenge. And because of that, a lot of people have continued to become much more innovative in how they source PPEs and sometimes how they ration PPEs. So in a way, they are well aware of the challenges, but it's a challenge, it's a resource challenge that it's been very difficult to overcome. So that's really it's where we are, but we know that everyone is going to have to put their hands on deck to make progress on this.
Okay. I'm going to move on to some pre-submitted questions from MPs now. And the first one is directed to Dr. Alonso. It comes from Stephen Doughty, MP. And he says, I am proud of the enormous progress we've made in the fight against malaria and the leadership role that the UK has played. What are some of the lessons we've learned that can help us to tackle this new crisis and protect the hard-won progress we've made? So what have we learned from our contribution to the global malarial effort, which could perhaps help us in the fight against COVID-19, Dr. Alonso?
I think we've probably learned quite a few things. And I think the UK again has played a key role in bringing in the thinking and the strategies that have really helped the global community. So I think the need to work more coherently between partners, even within organizations, and I'm even speaking for our WHO, the need to work under the leadership of the country, the affected country itself, to achieve maximum impact is essential. The need to work across systems. Vertical programs or vertical actions may have a role in specific situations, but the long-term solution is our capacity to integrate it into a given health system, and thus strengthening health systems to effectively deliver in an efficacious and in an equitable way the interventions we must get across. All those principles are going to be essential in our COVID fight. And finally, I think understanding that equity or the equity dimension is a critical one, that everybody has to play their role, and that includes the voice of the affected communities, and thus working together in a framework of multilateralism under the leadership of the affected countries themselves, through strengthening and enabling an effective health system are going to be our key lessons for our global malaria fight, and are going to be key lessons for the management of the COVID-19 epidemic in a malaria context.
Okay, thank you, Dr. Alonso. I'm going to bring in Professor Azra Ghani and Dr. Thomas Churcher now, both from Imperial, with a question from Hannah Bardell, the MP, SNP MP. I think she was on earlier. I don't know if she's still listening in. She had to go and she was selected to ask questions in the House, so she may well still be with us, but I'll read her question to you now. Having visited Malawi a few years ago to see firsthand the development and education work of the Scottish and UK governments, it's clear that some great work has been done. But it's also clear that vulnerable infrastructure in countries like Malawi, which has already been impacted by flooding in recent times, is going to be a huge challenge as COVID-19 spreads. I'd be keen to hear the panel's thoughts on how we can best use our existing programmes and capabilities to support countries such as Malawi and those most at risk of malaria resurgence to protect their citizens now and in the long term. Professor Ghani, can I come to you first on that, and then we'll go to Dr. Churcher?
Yeah, thanks very much. Yeah, I think it's really important to focus on the positives that have come out from the huge investment that the UK has made in malaria. And I would single out one thing that I think has been particularly important with this COVID pandemic, and that's the investment in surveillance. We know surveillance is critical for picking up new infectious diseases, for being able to track the cases during this epidemic. And there has been a huge investment in that particular area in Malawi and in many countries, and particularly tailoring the interventions to be appropriate to the local context. And I think that information will be very helpful. The other is research. We have a lot of research colleagues, for example, in Malawi that we contact with. Many of those research connections actually are people who day to day have been working on malaria. So the investment in the research capabilities and staff that has been undertaken through the malaria investments means that those people and those trained personnel are now also in place and able to help respond to the COVID epidemic. One thing I did just want to mention is that we of course have a malaria vaccine that is currently in pilot implementation. Malawi is one of those countries that hopefully at least will have protected some of the children that received that vaccine. And also to note that there's ongoing research still into better malaria vaccines by the same group that of course is now responding in terms of the COVID vaccine in Oxford.
And Dr. Churcher? Oh, come off mute, Dr. Churcher.
Still haven't learned these things.
Brilliant.
Just to emphasise what Dr. Alonso and Professor Ghani say, that these kind of local specific responses are going to be key, both for when the COVID epidemic hits and the timing of that relative to the malaria epidemic, because as clearly if they both coincide, there's going to be real issues. And then that's going to be, part of that is going to be communication, communicating to communities about how to, should for example, children get fever, how this is probably still more likely to be malaria than COVID in that particular, and therefore to seek treatment and make sure that it doesn't cause any more problems. And similarly to kind of, as I mentioned before, implement these preventative measures which can really help reduce the burden of all diseases during a period of time of COVID and malaria at the same time. So really, prevention and treatment are going to be key, and getting them the tools to be able to do that and continue to do that in a time of COVID will be essential.
I'll just ask a follow-up question on that, Dr. Church, because I think you mentioned earlier one of your concerns was about detection and work going on in labs being diverted to the COVID-19 response, meaning that some of the advances that have been made might be slowed. Just tell us a bit about that. What happens on a basic level in the global health community when you have a pandemic like coronavirus? Do lots of people get repurposed, and does research unfortunately fall by the wayside because other pandemics become a bigger priority? Perhaps as well, Professor Ghani can come in on that.
Yeah, I think both Dr. Alonso and Professor Ghani probably be better than me, but I think in these communities often there is one health person in that community, and they have multiple roles to do, and so they are understandably going to be massively overwhelmed by what's going on and not necessarily have the tools to help them diagnose these things and others. And if they don't have the equipment they need, as Dr. Alonso said, there might be a lack of diagnostic tests because tests have been moved over to out of malaria and onto another disease, then that could be really impeding people's ability to deal with both these threats at the same time.
Professor Ghani and Dr. Alonso, could you come in on that? I mean, does suddenly, and Dr. Eze, if you want to, does sometimes pandemics become hierarchical in the list of priorities? Is it that simplistic?
I don't think it is. I think we're trying to focus on health generally, rather than just a single disease. It does become overwhelming. So a lot of people, I mean, in our own unit in particular, we've had a huge focus on this, but some staff retain their focus on the other endemic diseases. It's an inevitability in some senses, but actually I think what COVID has taught us is that it's a much broader issue, because the types of interventions that are having to be put in place to control the coronavirus are really having such a broad economic impact that it's a tricky balancing act between saving lives from one particular infection compared to disturbing systems for other infections, but also disturbing livelihoods and affecting things like food supplies, nutrition, and other things that affect well-being more generally. So I think this really has brought the world's focus to how much infectious diseases actually can disturb a whole range of things.
Dr. Alonso, do you note that obviously with the WHO being constantly in the headlines and talk about disease spread generally, perhaps is there a positive consequence to this of global awareness of simplistic measures like hand washing to being more self-preserving, social distancing? Might that have overall in the long term a better impact on global health outcomes?
It's always great to try to see some light in the middle of the storm, and the answer is probably yes. These are really unprecedented times. The world had never faced something like this or for the previous 100 years. Inevitably, the concept of the COVID-19 pandemic takes precedence at this point, and certainly in WHO, it's at this point all hands in deck. But echoing what Dr. Churcher and Professor Ghani have mentioned, this is a balancing act. And although the first initial response, and I'm particularly concerned as of the endemic countries, is it's all about preventing COVID-19 impacting and transmitting in our country, we do need to be able to reconcile that COVID-19 is a major threat, but the disruptions that could be caused because of COVID-19 may be even larger than the impact of COVID-19 at the same time, and therefore avoid a false dichotomy. It's not COVID-19 or malaria, it's not COVID-19 or pneumococcal disease. There are two sides of the same coin, which is health. And how do we actually preserve health, and in this case, malaria gains in the face of a COVID-19 situation. And finally, to the point, I think, and again, echoing what Professor Azra has said, this pandemic just reminds us something that we all knew, but we've often forgotten, and that is that infectious disease is nothing of the past. It's not some 19th century problem that we've dealt with. Infectious diseases are the one thing in the health area or in the biological area that can imply systemic or even existentialist threats to our societies. And just recognizing that, or rather not forgetting that, is going to be essential. We've seen in the past years, and again under UK leadership, the entire discussion of antimicrobial resistance, which again kept the focus on infectious disease. For many parts of the world, the malaria, the TB, the HIV, all of them communicable disease, constitute their daily pandemics. And thus retaining a strong focus on infectious diseases as our key threat is going to be a lesson that we should not forget out of this one.
Dr. Eze, do you have anything to add on that?
I was just going to talk a bit more on like the lessons that have been learned on the ground, which is much more around knowing that people are beginning to pay more attention to washing their hands, to social distancing. Within hospitals, we've been able to see one of the lights at the end of the tunnel, meaning things, understanding now that a lot more healthcare acquired infections, other healthcare acquired infections have now reduced, things like C. difficile infections. So if we took just that lesson away as healthcare workers, it would be a silver lining from this pandemic. But in other ways, I do believe that a lot more research in what we're doing in COVID and malaria, not COVID or malaria, just as Dr. Alonso has said, would learn a lot from it down the line. And although we are in the pandemic right now, we do know that we will have much more information down the line that would really transform the way we work as people and as frontline health workers.
I'll just go to Wendy very briefly before I ask the final question from Baroness Heyman, because I note that we've got 5 minutes left. I suppose when it comes to the UK population, thinking about infectious diseases, perhaps there are things that they think happen to other people in other countries. And I'm wondering, Wendy, when you're trying to make an argument for things like malaria funding, I don't know whether the British public is necessarily on side or has been in the past, although no doubt proud of the UK's contribution globally. I wonder whether Britain's experience of living through a global pandemic will make people more attuned to the need to provide funding and help for other countries who deal with this on a much more regular basis, Wendy.
I think that I hope it does. I think the British public, on the whole, are very, very generous, and you know, a lot of people do give to international organisations and support the work of DFID and organisations like Malaria No More. I always think we still have to keep making that argument for the work that we do in this space. But I think even something as simple as hand washing, which we've really reinforced here in the UK, we're also explaining how important that is globally as well. Personally, I think that really hits home, and that's why I know that the work that we're doing in the COVID-19 space and the partnership with Unilever around something which seems so simple, such as hand washing, is a really important lesson to us all around the world, here in the UK and overseas as well. So if there's one thing that we can take from COVID-19, I think there will be many lessons learned by many of us on many different levels.
Thank you. And finally, from Baroness Heyman, that last question. We've dealt with this a little bit, but I think we're going to just conclude with thinking about how we can improve our responses. So she says, COVID-19 will have a lasting impact on society and communities around the world and will no doubt change the way we view and deal with global health challenges. Are there ways in which we can change our approach for the better? Let's start with Elvis, and then we'll go through the rest of the panel just to finish up now before 12. I think we've got 3 minutes left.
Thank you, Camilla. I was just going to echo what Dr. Alonso said again, that the biggest, and broadly speaking, infectious diseases like malaria are still with us, and we just need to pay attention to them. Thank you.
Dr. Alonso, your final thoughts?
Working together, solidarity, research, knowledge, use of data, empowering countries. I think those are some of the key questions that they are lessons. We've learned that we knew them before, but we haven't always acted in coherence with that. And this is a great opportunity to rise to the challenge.
Thank you. Dr. Churcher?
So I think, you know, things are obviously going to get probably, I hope not, but they're probably going to get quite bad. And then afterwards, there's going to be a long period of recovery. I think countries will really need help in this kind of period of time to bring together all the tools that they need to rebuild and hopefully move on to attack all these diseases, not just COVID-19, but malaria, and refocus the efforts WHO and others have done over the last couple of years.
Thank you very much. And finally, Professor Ghani.
Yeah, I would just echo everything everybody else has just said. We are still in the midst of this pandemic. We haven't yet got the light at the end of the tunnel, or indeed a way out. But what we do know is that we will need to work together across communities across the globe to be able to respond to this pandemic, but also to put everything in place to respond to infectious diseases more generally in the future.
Thank you very much, all of the panellists, for joining us today, and thank you to everybody watching. I mean, I think we've concluded that over the last 20 years, so much has been achieved in the malaria space that it does make you wonder why perhaps there hasn't been quite that global joined up thinking on this particular pandemic, having used the malaria experience as one of success and having saved, as we said at the beginning of this, millions, if not billions of lives. So moving this forward, I think we can take some positives with everybody's contribution here as to not only individuals changing behaviour, but also the international community changing behaviour moving forward. But we have to make sure that all of this good work in the field of malaria is not undone because of the huge and understandable distraction that coronavirus is continue to have. We talk about the statistics here in isolation, but of course, as Dr. Alonso points out, we don't have a clear picture of the situation in Africa at the moment. We don't know what the spread is going to be. We're talking about an R rate here of trying to get it below 1 or 0.5, but actually we don't seem to have any firm data at all on what that R rate might be, as you say, in countries like Burkina Faso or beyond. So very much more to report on that, and for all of the panelists here in their different guises to work on, I think. But thank you so much. It's a World Malaria Day on Saturday, which will be marking Malaria No More, obviously at the forefront of that. Thank you to all of the panellists for all of your efforts in this field, and thank you so much to everybody who's taken part in this webinar this morning.
Thank you.
Thank you.
Thank you.
Thank you.
Thank you.